Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम एम्स पटना नर्सिंग ऑफिसर एग्जाम 2020 का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। 126. The movement of particles from region of higher concentration to region of lower concentration is called A. Diffusion, B. Filtration, C. Osmosis, D. Hydrolysis. Correct answer A. Diffusion. 127. In acute pancreatitis, the levels of which of the following enzymes remain elevated for 7 to 14 days? A. Urine amylase, B. Serum amylase, C. Serum alkaline phosphatase, D. Serum lipase. Correct answer D. Serum lipase. 128. Which of the following is not a manifestation of interstitial cystitis, IC? A. Frequency, B. Incontinence, C. Urgency, D. Pelvis pain. Correct answer B. Incontinence. 129. The disease that occurs due to the defect in the genes of one or other parent and is transmitted to the offspring is known as dash disease, disorder. A. Congenital, B. Organic, C. Hereditary, D. Allergic. Correct answer C. Hereditary. 130. Tonometry is the method of measuring the A. Pressure inside the lungs, B. Pressure inside the ear, C. Intraocular pressure, D. Blood pressure. Correct answer C. Intraocular pressure. 131. Hemophilia is associated with A. Chromosome 11, B. Y chromosome, C. Chromosome 21, D. X chromosome. Correct answer D. X chromosome. 132. After a renal transplant, the rejection that occurs within minutes is called A. Hyperacute rejection, B. Chronic rejection, C. Acute rejection, D. Subacute rejection. Correct answer A. Hyperacute rejection. 133. Which of the following drugs is used for the dilation of pupil? A. Tropicamide, B. Betamethasone, C. Levofloxacin, D. Gentamicin. Correct answer A. Tropicamide. 134. What is the minimum possible score of Glasgow Coma Scale? A. 3, B. 1, C. 2, D. 0. Correct answer A. 3. 135. The voice box is known as A. Larynx, B. Diaphragm, C. Bronchioles, D. Pharynx. Correct answer A. Larynx. 136. The most serious complication of deep vein thrombosis, DVT, is a blockage known as dash. A. Formation of venous ulcers. B. Chronic occlusion of veins. C. Gangrenous development of veins. D. Pulmonary embolism. Correct answer D. Pulmonary embolism. 137. Painful swallowing is known as A. Dysphagia. B. Odynophagia. C. Ataxia. D. Dyspepsia. Correct answer B. Odynophagia. 138. The antidote of warfarin is A. Protamine sulfate. B. Vitamin K. C. Heparin. D. Acetylcysteine. Correct answer B. Vitamin K. 139. The most common lung cancer seen in non-smokers is A. Small cell carcinoma. B. Adenocarcinoma. C. Large cell carcinoma. D. Squamous cell carcinoma. Correct answer B. Adenocarcinoma. 140. The presence of stones in the urinary tract is called A. Kidney lithiasis. B. Stone lithiasis. C. Urolithiasis. D. Cholelithiasis. Correct answer C. Urolithiasis. 141. The act of purging or purification of emotions is called A. Compulsion. B. Catharsis. C. Cataplexy. D. Confabulation. Correct answer B. Catharsis. 142. Which of the following is expected in a patient who is diagnosed with an organic mental disorder? A. Intact memory. B. Appropriate behavior. C. Disorganization of thoughts. D. Orientation to person, place and time. Correct answer C. Disorganization of thoughts. 143. According to Erickson's 8 stages of development, initiative versus guilt takes place at A. 20 to 25 years. B. 10 to 15 years. C. 13 to 19 years. D. 3 to 5 years. Correct answer D. 3 to 5 years. 144. Which of the following is not a sign, symptom of the obsessive compulsive disorder? A. No fear of self-harm. B. Fear of germs or dirt. C. Obsessive thoughts. D. Compulsive acts. Correct answer A. No fear of self-harm. 145. Which one of the following is derived from the plant Cannabis sativa? A. Cocaine. B. Morphine. C. Ganja. D. Opium. Correct answer C. Ganja. 146. False sensory perception without real external stimulus is known as A. Hallucination. B. Illusions. C. Delusions. D. Thought insertion. Correct answer A. Hallucination. 147. A patient admitted in the psychiatric ward refused to eat her lunch, stating that the food is poisoned. This kind of response is an example of A. Hallucination. B. Sympathy. C. Illusions. D. Delusions. Correct answer D. Delusions. 148. The label indifference is related to A. Conversion reaction, B. Obsession compulsions disorder, C. Anxiety disorder, D. Phobic anxiety. Correct answer A. Conversion reaction. 149. The disulfiram therapy is indicated in A. Acute intoxication, B. Cannabis dependence, C. Anxiety disorder, D. Chronic alcoholism. Correct answer D. Chronic alcoholism. 150. A person suffering from a severe anxiety disorder is able to speak freely with certain people only and is not able to speak with others, especially with certain social groups such as classmate at school. A. Mutism, B. Aphasia, C. Selective mutism, D. Epilepsy. करेक्ट आंसर सी, सेलेक्टिव म्यूटिज्म। कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज।